So you may have heard about ketamine and the possibility of its role in Matthew Perry's death. Well, in this video today, I will discuss exactly what that means. We'll discuss what is the guidelines or evidence for using ketamine for depression. We'll discuss what are the risks for ketamine, and we'll discuss the possibility of its role in Matthew Perry's death. Howdy, I'm Dr. Islam. I'm board certified doctor trained at the Mayo Clinic. Don't forget to subscribe to my channel for more information. So I want to start off by saying, but I am not Matthew Perry's doctor. I'm not a celebrity doctor. I don't know what happened. I don't know the details. So I'm getting all this from secondhand information. But we do know that Matthew Perry died a couple of months ago. You may have heard about this, where he was found to be actually drowned in a tub of water. And recently we found out that there may have been some ketamine in his system during the time when he passed away. So what exactly is ketamine? Ketamine has been used for a long time as an anesthetic agent. In fact, it's classified as a dissociative anesthetic. We typically use this in anesthesia whenever we're giving you sedation to put you to sleep. It can provide a trance-like effect or even hallucinations in some individuals, but also has a very effective pain response as well. So for those individuals who are going under surgery, that may end up being a painful surgery, or they may have pain as a side effect, ketamine is a very effective and safe option in the right hands to help out when it comes to anesthesia. We do this all the time, and a lot of our anesthesiologists and CRNAs use ketamine as a way to put people to sleep. In 2006, researchers at the NIH, or National Institute of Health, showed that ketamine can actually be used to treat severe depression. And since then, we've had studies after studies suggesting and showing the benefits of ketamine with both depression and PTSD. And the effect, which is amazing with ketamine, is that it actually works within hours, which is very different from the effect of other medications like Prozac, which can take weeks to get into the system. Now, I have to stress, as of now, ketamine is not FDA approved for depression or PTSD, but more and more studies are showing the benefits of using ketamine to treat this condition, to get people kind of over that hump and to get them feeling better. In fact, for a lot of patients that have refractory depression or have PTSD is very severe, using ketamine can break that cycle in the brain to get them in a much better mental state. This video is sponsored by Lubbock Gastroenterology Hemorrhoid Banding Clinic. We take care of hemorrhoids, and I know this is something people don't want to talk about, but if you're suffering from hemorrhoids, whether it's pain, bleeding, itching, or pressure, you don't have to suffer on your own. I know it's a pain in the butt, but we can fix that. We can get this taken care of for you. We do what's called hemorrhoid banding, which is a quick, easy, painless procedure that only takes about 10 seconds. But no one believes me. This is the most effective way to take care of hemorrhoids without the need for surgery. So if you want to learn more information about hemorrhoid banding, don't forget to call this number, where we can get you scheduled the same day to get your hemorrhoids taken care of. So what exactly is the data that's used for ketamine? Once again, I have to stress, this is an off-label use of this drug. It's not FDA approved to treat depression. But studies and clinical trials have further shown how it can treat really resistant depression in a quick and effective, and so far safe manner. It has a rapid onset of action, but in addition, it also has a rapid way of getting out of the body as well, so you don't have significant side effects that last long term. So what are the risks of ketamine? Keep in mind, it is an anesthetic, so obviously it'll put you to sleep, but it also acts as a dissociative anesthetic. It can make you have hallucinations. It can disassociate from where you are. It can change your perception as well. And that can also lead to high blood pressure and an increased heart rate. The long-term effects and risks of ketamine are not fully understood at this point in time, especially when it comes to treating depression and PTSD. So even though ketamine works effectively very quickly, the effects can wane after a couple of days to a couple of weeks. So we do know that Matthew Perry used ketamine to help treat his depression. And so far, the most recent infusion was a little bit more than a week before his death. Because it was an IV infusion, and typically the side effects will go away within a couple of days, it is very unlikely that ketamine played a direct role in his untimely death. Keep in mind that ketamine should only be used under the care of a licensed healthcare provider. And always make sure that you go over the risks and benefits about using off-label medications, because they're off-label for a reason, because we don't know exactly what is going on. Let me know in the comments down below if you have a question about ketamine, its use, or what are the options for that as well. Thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel for more information.